Namaskara. I'm Dr. Sunita Rana Agarwal from Dr. Agarwal Hospital's Bangalore. I am an ophthalmologist and I practice genetic medicine. Eye floaters are any object that's coming in your vision even when you're looking at something else. You're looking at somebody else and suddenly something comes into your vision. These little things look like insects floating, and you think there's an insect in the room and you go around with your bat, but that's not the situation. More often than not, they have retinal cells that have gone loose into the vitreous. So you can get retinal detachment, vitreous haemorrhage, posterior vitreous detachment, sometimes cataract, cornelopacities, uveitis. All of them can produce floaters. However, the floaters that come which are moving, that means you can actually see the movement of the floaters, they are coming from the vitreous because that's what's moving. Very rarely you can get even uveitis producing those kind of floaters. But when there's some object in your eye vision and that is not moving, then it's cataract or glaucoma or cornelopacities. When the cornea fills up with a little bit more fluid, once again it gives you refractive errors in different ways, and these aberrations can be seen as floaters. Floaters are not at all normal. We do not get floaters. Sometimes if you have gone through a fight and somebody has boxed you, you'll find floaters there, but those are from some amount of cells getting lodged from the retina or from retinal blood and or posterior vitreous detachment. If you're a young person, you can come over it and all this will get absorbed. But when it is diabetes, when it is hypertension, when it's age-related macular degeneration, when it's myopia, and these are the causes of your floaters, it's a degenerative condition. This requires medical attention, this requires treatment. Some of the ways that we can treat them without having to resort to surgery is to reduce the amount of floaters. We cannot take away the floaters. Now, to take away the floaters, we would need to do a vitrectomy, which is a very big surgery. But we can reduce the chances of the floaters, and time and space with your body healing mechanisms will take away the rest. What do we need to do? We take 1 drop of blood, give it injections to you. It's when you're seeing, not only in blight, right, even in blue light, if you look at the sky and you're seeing, what are you actually seeing? There's some movement of the red blood cells that cornea, your retina is actually picking up. When you're seeing it in white light, then you're looking at floaters. That means you're looking at something that is inside the vision's area. Through this 4 areas of our eye, light must transfer, absolutely transparent medium. Cornea, antechamber, lens and vitreous. If for any reason there is any object inside these 4 areas, we will see those black spots with white light. Usually from what I have seen, they cannot be caused by screen time or stress. However, what we have seen in our practice is that very often dryness in the eye causes a lot of problems on the retina, and thereby it leads to floaters as well. Myopia, once again, it causes myopia. Increased screen time and you're looking at myopia or some amount of glass power in some format or the other. For us to be able to reduce that eye strain and dryness in the eye, treat that, certain amount of floaters will be treated, not the serious ones, which means not the ones which are looking because of diabetes, hypertension, retinal detachment, age-related macular degeneration, cataract, glaucoma, cornelopacities, uveitis. No, none of them. They will be treated only by your eye care practitioner. When they become too much and they produce blurry vision, more often than not, if you are able to look at the distant object, then the floaters will not come into your eye. But when that does not happen, and even if you're looking at a distant object and the floaters are still in front of your eye, you need to visit an eye care practitioner.